Everybody's here that's going to join, and hopefully we'll get a few more, but I want to thank you. Today is our third session on data comes in all sizes. And today I will be working with Stevie Tsai. She's a senior manager at Mountain Pacific Quality Health, and she has a doctor of pharmacy and a master's in health services administration. And I'm Sarah Leek, and I'm a quality improvement team lead. And we will get started on this session. Thank you very much. I'm trying to advance my slide. Just one sec. I'm sorry. Stevie, I'm not sure why it's not advancing for me. Can you bring it up for us, please? Very strange. We just tested it too. Oh, I got it. Did I, or did you just bring it up?
There, that's all you do, so we're good.
All right. So this should be a familiar slide that's showing the 5 elements of the QAPI program. So today we'll be reviewing element number 4, which is performance improvement projects, and also number 5, systematic analysis and systematic action. In the previous sessions, we talked about elements 1, 2, and 3, and these were recorded and they can actually be reviewed at your convenience. And I think Mary was going to put a link in there or give you some information on how you will get this information on the recording. So during the third session on October 28th, we looked at the feedback, data systems, and monitoring. So I kind of wanted to just recap a little bit on that. And during the session, Alana Jarman addressed why, what, and the methods you can use to identify your required data and for reporting. So at the same time, you can also look at other important data and that's beneficial to your quality. She showed templates of the data collection list and the collection and monitoring plan. And she also provided an example crosswalk so that you could visually see where metrics intersect with different projects. Tools for identifying your gaps and opportunities were reviewed, and this helps the team identify projects' potential effect on your return for investment, and also provides a guide on how to prioritize that work for your QAPI efforts. Today, we'll walk through the 3 topics noted. Performance improvement projects are used to plan, implement, measure, monitor, and document changes using a structured process and tools. Through the use of performance improvement projects, the focus is on topics that are meaningful and address the needs of stakeholders, such as patients or residents in a nursing home, and of course, your staff. We will look at different tools used through the PIP and PDSA process. The systematic analysis and systematic action models and promotes systems through a systems thinking approach. A systematic approach is used to determine when in-depth analysis is needed, what are the causes, promote sustaining improvement, and develop and integrate your policies and procedures. Through the QAPI process shouldn't just be putting out fires, it should also be doing fixing what's wrong with your system. A performance improvement project is not just casual effort. So it entails a specific written mission to look into a problem area. So during PIP, a facility will identify and implement some changes that are expected to result in improvement. Then you can check whether these actions simply support the current process, or what you would say you would consider that they're weaker actions, or whether they make a difference and have a lasting improvement in the area they were intended to improve. So just in the chat, if you could, what do you think are some concepts of change that you need to consider with any improvement project? Does anyone have any ideas on some of the concepts of change to consider? Workflow improvement, that's a good one. Workflow is important. Eliminating waste, that's another one. Managing your time, making sure that you're efficient in what you're doing. Focusing on variation. And I think you can find that variation by doing that workflow and looking at that workflow and process closely. So Alana introduced this model for improvement in session 2, and it was developed by associates in process improvement and adopted by the Institute for Healthcare Improvement and also for CMS in quality improvement, initially in the nursing homes. So healthcare improvement is a tool for quality improvement. So this model asks 3 questions, as you can see here. What are we trying to accomplish? In other words, what are we aiming for? Second is, how will we know a change is improved? And data is very important, and it's good information, and it is fundamental to knowing, especially if you have answered this question or not. A third question is, what can we change that will result in improvement? This helps to determine the changes you will test. In addition to these 3 questions, there is the plan, do, study, act cycle, which I know most of you are familiar with. The PDSA cycle guides the test of these changes to determine if that change is an improvement. There are also 7 steps outlined in the IHI toolkit. We will be focusing on numbers 3 through 6 for performance improvement. Take note of the boxes that are highlighted in green. In previous sessions, we stressed that QAPI is not just the quality department, but it's the responsibility of all staff. Therefore, the team for a process improvement project should have representatives from all parts of the organization that contribute to this process. There is also the need for leadership support. Aims are set to have a clear and firm direction. The aim should be time-specific and measurable. We spoke about this and how SMART goals are a good tool to ensure that you have clarity and a common goal. So in the planning stage, it is important for the team to examine the current state. And in doing this, you ask several questions. For example, what are we doing now? How do we do it? Who is involved? What is done well? What could we be doing better? All of this is in your discovery or in your planning stage. Some of the tools that you can use are brainstorming, a check sheet, and a SWOT analysis. And we'll look at that a little bit later. As Alana had noted in a slide last week, the root cause analysis is one of the fundamental tools for QAPI and is very valuable in identifying causes of problems. This will be explored in more detail. Rapid cycle improvement is a quality improvement method that identifies, implements, and measures changes made to improve a process or a system. But what's different about rapid cycle improvement is that changes are made and tested over periods of 3 or 4 months, or even less. After planning the improvement, you apply it in a small scale, and if that desired improvement results apply to change to, you can then apply this to a larger population and test for continued improvement. The PDSA cycle can help execute and test changes. So some benefits of this approach are that the impact of improvement measures are realized very timely. Failures are noted quickly and then you can adjust. And testing small populations before spreading change increases the confidence in the success of processes and minimizes any kind of resistance. So system improvement has many related terms used to identify the quick, timely cycle for testing change. Could you please type in the chat other words that you have heard or have used in your quality improvement activity or discussions that refer to rapid cycle process improvement? Are there some other terms that you have heard that you see out there? And think about it's quick, it happens often. Anybody have some words they can put in there? Well, I'm going to go to the next slide and kind of brainstorm some words. So there's the incremental, it's an agile, so you can do it quickly. Stevie had put in there a sprint. I don't know that that's in this. It's very adaptive. So like they said, you do it quickly. And if things aren't going as you had planned, you can quickly change some make some minor adjustment and then actually do that similar test again. So this is some words that you'll also hear if you're talking about that rapid development process. And I put a quote in here that I thought was very appropriate, that great things are not done by impulse, but by a series of small things brought together. I had mentioned that we were going to look at a couple tools. The first one is the swim lane. This is a swim lane map, and it is similar to a flow chart as it maps out your process, what decisions need to be made, if there's any loops. But in a swim lane, you actually put in the actions, you delineate who is responsible for those actions. And so it would be a person, it could be a group that's responsible, but you can clearly see that like the quality staff in the second line, or just add whatever function is responsible for that. Another item that you can use in your analysis is a SWOT analysis, and I think most of us have definitely used these before. Excuse me. It provides clear, easy to read map of internal and external factors that may help or harm your project. So by listing these and organizing them, you can look at the strengths, weaknesses, opportunities, and threats. And you can clearly see in an organization the chances for specific project success and given these present environmental factors. Oh. Okay, Stevie?
Thank you, Sarah.
Yes.
And thanks everybody for letting me hop on and share a little bit about my passion for all things root cause analysis and data. I get to talk to you a little bit about root cause analysis, or RCA. That's a systemic process for identifying contributing factors that cause variations in performance. We're using it to identify underlying causes of a problem, and it allows us to dig deeper and really look for the reasons behind why an event or action is occurring. I was not familiar with QAPI prior to joining Mountain Pacific, but I have been honing my RCA skills for over a decade. This is a primary tool of quality improvement that we use in pharmacy management. And point of incident RCA, so like right where it happens, is the gold standard for quality improvement in pharmacies and is part of a comprehensive approach to continuous quality improvement. Root cause analysis identifies the contributing causal factors that underlie the different variations we have in performance. And like I mentioned, it allows us to dig deeper. We're able to take time to interview our team, talk to the people that were there when an incident happened. And it involves asking why until you get to the actual cause of the problem. So like one thing I feel like that happens often when there are errors in healthcare is we typically want to assign blame. For example, when I'm working in the pharmacy, if there's an error, always my first instinct is to say, did I do that? That blame is always there, right? It's part of who we often are as people, mostly because it's important to us to take good care of our patients. But assigning blame is not what QAPI is about. QAPI and the RCA process should really be about identifying the system issues that allow errors to occur. And it's part of why tools like Just Culture, where it encourages that organizational and personal switch, where we're changing to accountability and identifying system level issues that cause harm rather than roles or people that cause harm. That root cause analysis is, again, an effort to identify the cause of the problem, not find out who to blame. Next slide, please. So the RCA tools I wanted to talk to you about today are the 5 whys, and then also cause and effect diagrams or fishbone diagrams. So next slide, please. This is a quick overview of the 5 whys tool. This is one of my favorite root cause analysis, primarily because it tends to be quick. It doesn't require a lot of training for the people that will be involved. And we can do it with relatively limited resources. The 5 whys is a method where we just use a series of questions to drill down into successive layers of a problem. It helps with those stubborn, recurrent problems that are often symptoms of deeper issues. As humans, we are wired to move toward quick fixes. My husband and I talk about this all the time. And while quick fixes are convenient and often feel like they're going to be the most rapid way to solve something, they often only deal with those surface level issues. And then we're wasting resources like our time, our energy, our efforts, and not using them to address what could otherwise be the real cause. So we're not tackling that real cause. So the basic idea is that each time you ask why, the answer becomes the basis of the next why. It's a simple but powerful tool that quickly cuts toward, like, away from the outer symptoms to reveal the underlying causes. It's useful when you don't need advanced statistics or a lot of data. So you wouldn't necessarily want to use it for very complex problems. But it is a way that we can analyze more thoroughly. So we have a little example for you today where I want to just talk about how it can be a way to solve everyday problems. So for example, you are leaving your garage and your car gets a flat tire on your way to work. So to start our 5 whys, we'd say, why did I get a flat tire? You want to go to the area of the problem. So you'll get out, you'll look at your tire and see, oh, there's a nail in my tire. Well, why is there a nail in my tire? You ran over a nail in your garage. Why were there nails on the garage floor? You look and you see a box of nails on a shelf is wet. The box fell apart and the nails fell from the box onto the floor. You could stop here, right? Because now we could pause, we could take the nail out of the tire, get the tire repaired, sweep up the nails, and we could be done. But why was the box wet? There is a leak in the roof and it rained hard last night. So really the root cause of the problem is the roof is leaking. If you had stopped with the nails and swept up the nails and moved on, you would really miss the bigger cause of the problem, the root cause of that problem. And so you can see how that tendency to sort of just stop here at the surface level limits our ability to get lower. One of the important pieces of that is the go and see philosophy. It's important to involve people with personal knowledge of a process or system that has failed and caused the problem to be part of the discussion. We really need that actual happening opinion, people who are right there, rather than perhaps a supervisor who isn't necessarily involved in those processes. In the pharmacy, this might look like a pharmacy manager going and observing a location where an incident occurred, looking at the workflow processes, seeing how it might have happened, and typically would involve talking to the staff members that were there when the incident occurred. So you could get some things that might not be the same day to day, like staffing levels, stress, different sorts of occurrences that can impact whether or not errors happen. Like I mentioned before, the 5 whys is not always helpful. If a problem is complex, it can sort of lead you to pursue a single track or a limited number of tracks for an inquiry when there might actually be multiple causes. So in cases like that, we'd want to use a wider range method, such as the fishbone diagram, which we'll talk about next. So next slide, please. So this on your screen is a fishbone diagram, or an Ishikawa diagram, or a herringbone diagram. So it was popularized by Kaori Ishikawa from the Kawasaki shipyard in the 60s. And we call it a fishbone or a herringbone diagram because it looks like one. A fishbone diagram allows us to combine brainstorming and mind mapping, and it really pushes you to consider all the causes of a problem, not just the ones that are most obvious. So you sort those possible causes into various categories that branch off from the original problem. This is a great way to visualize cause and effect for those members of your team that might be visual learners and thinkers. And it provides us a really structured approach in comparison to the 5 whys because it really helps guide some of that brainstorming. So you would put your problem statement or the effect, so what happened, into the mouth of the fishbone, which on your screen is the blue box that's on the right. Food for thought, your fish can swim either way. If you're a person where you want it to start on the left and move forward, that's how I am. You can orient your fish whichever way you would like. So you start with your problem in the box, and then you make smaller bones of possible contributing causes under various cause categories. So on this particular example, we have equipment and supplies, environmental, rules, policies, procedures, staff and people. And by creating those buckets, that allows us to think critically in an organized fashion so that you can dig deeper into some of the causes of an event where you might otherwise have missed it. If no one suggests to you to think about what equipment you have available, you might not notice how it contributed to an event, for example. And those things can be changed to meet the needs of your organization based on your workflow. Again, you're going to want to include your team members who have personal knowledge of the processes and systems involved in the problem or the event that is being investigated. The team would then use the fishbone diagram tool to carry out some specific steps. So first, you'd want to agree on the problem statement. This would be written into the mouth of the fish. You want this to be clear and specific as possible about the problem. And be wary of defining the problem in terms of a solution. For example, we need more of something. We need more staff. We need more cows. We need more, those sorts of things. That might be a solution later, but shouldn't be defined in the problem. And then your team will want to agree on the major categories of the cause of the problem. Those things often include things like equipment, supply factors, environmental factors, those policies, staff, software, whether or not something, is in good working order. So that'd fall on your equipment. And then you're going to brainstorm all the possible causes of the problem, asking, why does this happen? List all the ideas. and have a facilitator write the causal factor as a branch from the appropriate category. The causes can be written in several places if they relate to several categories. You can have subcategories branching off if you need those. Continue to ask why and generate those deeper levels of causes and continue to organize them until you run out of ideas. This will help you really identify all of the root causes and allow you to address them to prevent not only the current problem, but possibly future problems as well. Next slide, please. So once you've got your root cause analysis, you know what your problem is, what the cause is, then you have to do something about it, right? So this is when our PDSA cycle becomes very helpful. So plan, do, study, act is just a shorthand for testing a change. We want to plan it, try it, observe the results, and then act on what we've learned. This is the scientific method in an action-oriented learning environment, which the scientist in me really loves. So there are lots of reasons why we want to do this. By gathering some of this information, you can increase your belief or the beliefs of others that a change will result in an actual improvement. It can help bring your team on board to participate in the proposed change. It helps evaluate how much improvement you can expect. And it can help you decide whether the proposed change will work in the actual work environment of interest, which is always very key. It's not very helpful when we propose solutions that we don't have the tools or resources to implement. So, as you're planning, you need to you are looking to state the objective of your test. Think about what specifically you want to accomplish, why it's a priority, make predictions about what will happen and why. This is where the if we do blank, then this will happen. That is very helpful. That can help us think about unintended consequences, sort of troubleshoot some of those things. And then you can start making predictions about what processes will be changing, what will the new process look like, and then you're going to develop your plan to test the change. Your plan should be very specific, try to outline all the necessary steps, such as who will enact the changes, when will the changes be made, where will the changes occur, what team training and preparation do we need, how will patients be affected, which patients might be affected, what are our expected results, how will we measure those results? Do we want to put process or outcomes measures in place? We'll talk more about data in our next session. And then how will you inform your team about the change and how it's going? That is a really important piece. Often when we do root cause analysis, we don't trickle that down fast enough to the rest of the team, so they feel like they might have had wasted time. So you need to include that. When do we update people as we go through? Next slide, please. So now that we have our plan, the next thing we have to do is do it. We need to implement our action plan. When you have a committed team and a detailed plan, you're ready to implement your quality improvement initiative. You want to communicate that new process to your team, and then keep an eye on what happens. After the change has been implemented, regularly discuss the adoption of the new process at huddles or meetings, and collect that information. That will help you determine if the change had the desired results, perhaps even before all of your data comes in. And then you're going to want to think about what you observed. Write down your observations that you had during implementation. This could include things like how did patients react? How did the doctors react? Nurses, different people involved in the workflow. Did it fit with your system? The flow of the patient visit? Did everything go as planned? And then do we need to modify? So you're going to want to test that on a small scale, carry out the test, and then document any problems or unexpected observations. So then you can begin your analysis of the data. It's really important here to help your team stay focused through setting impactful goals, which we have talked about previously with SMART goals and those sorts of things. Next slide, please. So here we're going to take a little pause and bring up some polling questions. We want to ask you all just a couple questions to see if we can gather some information about our future sessions. So first here, how do you collect data for analysis? And you can select all that apply. So data collection and analysis are really at the heart of quality improvement. My love of data is what brought me to quality improvement and pulled me out of pharmacy. So we would like to know a little bit more, like I said, about how you collect that data. We'll give everybody about 15 more seconds here. So remember, you always want to collect data before you begin a quality improvement project. And commit to regular data collection. All right, it looks like we can go ahead and close that poll. All right, so we can see that a lot of you do rely on chart review and then manual tracking, EHR. It looks like we've got a couple people that use the Casper reports and some other third-party vendors to get us more information. Sometimes we have to be creative about our data collection. Or use that nationally available data. All right, I think we can stop sharing on that and pull up the next poll. So here we just like to know who are the active members of your data team. Again, you can select all. Just want to get a picture of who those people are that are helping you review data, collect data, decide what data is important, and who is helping you track those things as you move through a project. We'll give that about 5 more seconds. All right, we can display the results. So it looks like it's pretty common for this group that leadership is helping collect that data. The director of nursing is often involved, quality lead. For other individuals in chat, I see that we have individuals that were recruited specifically for performance improvement projects. That's a great idea, part of that comprehensive engaged team, using our supervisors or managers. I think anytime you can involve clinicians, it's helpful. So thank you everybody for that information. We can close that poll and move on to the next slide, please. All right, so the last little thing I wanted to talk about here is just the different types of data. So we need to analyze our data, review the performance to determine whether it meets the desired quality need. My caveat here when we talk about data quality is to avoid the quest for perfect data. When we operate in the real world, which we all are, our data is not always going to be perfect. So you have to decide where that threshold of good enough is for your organization. And then how you want to use that data to define the performance plan. As you interpret your data, you want to use a process of assigning meaning and determining significance. So as you decide what to collect and where, that should, some things weigh heavier than others. And then as you interpret your data, you want to evaluate and improve your activities. Did you get the desired outcomes? Do you have gaps? How do you plan to improve? Because quality improvement is a never-ending goal, right? There's no threshold that says this is good enough. We should always seek to improve our care. Remember, it's not just about numbers. You can have quantitative and qualitative data. Quantitative data is expressed typically in numbers. So it's quantity, amount, a range. So things like waiting times, mortality, hemoglobin level, cash flow. Those are all quantitative data. Usually we can track it over time and visualize it in charts. We should also be looking at qualitative data in healthcare though. This is data that can be virtually any type of information. Things like our CAPS or HCAP scores often include things that could be considered quantitative or qualitative data because we're measuring it, but it's often opinions. This could be patient experience information, anything that's non-numerical in nature. And it's particularly helpful to help us gain a deeper insight into an issue and understand the meaning, opinion, and feelings behind it, which is very important when you're in a patient service industry or you're working with people, which is what all of our staff is. So it's very vital to supporting the development of theories about what to focus on and what might make a difference, including so some examples of that would be things like waiting room observation, feedback about your experience of care, free text responses to a survey. All of that can be very valuable and sometimes even unsolicited. Those things are helpful as well. With that, I'm going to stop my part of this and I'm going to pass it back to you, Sarah.
Thank you, Stevie. And it was great to hear a lot of your firsthand experiences that you in with examples as a pharmacist and also now in quality improvement area. So thank you again. So we have gone through the plan and we've gone through the do, and now for the study section of Plan, Do, Study, Act. So by planning it is trying it, observing the results, and acting on what is learned. The team is able to test the change to see if it shows improvement. So reasons to test your change are to increase your belief that the change results in improvements, and to decide which of those proposed changes will lead to a desired improvement. So in order to evaluate how much improvement can be expected from the change, the cost, the social impact, the side effects from a proposed change, also to decide which combination of the changes will have the desired effects. And so you've looked at different changes and you may be putting a few together, and it will just bring you a lot more improvement if you do change X and you do change Y. Also to decide if you will work in the environment and help measures quality. So to minimize resistance upon implementation. So some tools that can be used to visually review and evaluate improvement are listed here: the Pareto chart, control chart, and a run chart. So this, we've given a visual of each of those charts, and a Pareto chart would be used to see which causes or problems occur most frequently. So you observe the Pareto effect when you see the 80-20 rule. So it's when 20% of the causes contribute to 80% of your overall problem. So sometimes when you fix that one problem, it will immensely improve the issue that you're having. A trend or a run chart is to give a visual representation of data over a period of time. So this is one example. What you can also do is put an upper and a lower limit. And so that is your upper lower chart. And you can easily see what is going beyond the upper and below the lower limits and do some analysis on that. Thirdly, we are showing a bar chart or a histogram. And this shows comparisons among categories that uses either horizontal or vertical bars. So these are three types of tools that I'm sure many of you have used already, but we wanted to put them in this slide deck just to give some information that you could potentially use in your projects. There's also at the end of the slides a list of all of the tools that we've talked about and some general information of when you would use those tools. So QAPI uses a systematic approach to determine when in-depth analysis is needed. So the facility uses an organized approach to determine if identified problems are caused by the way our care is delivered. The systematic actions look at comprehensively across all involved systems to prevent future events and promote sustained improvement. Facilities will be expected to develop policies and procedures and demonstrate their proficiency in the root cause analysis. So QAPI isn't just putting out the fires, it's coming up with policies, procedures, actions so that it fixes the wrong in the system. So we are now in the ACT stage. So the study went pretty fast, but you would take all of that data that Stevie talked about, all of that previous doing and collecting the data, and then you analyze it and determine what action to take. So you come to a decision. So if this was successful, if your team determines the plan resulted in success, then you can standardize that improvement and begin to use it regularly. And then after some time, you can return to your stage 1 of your plan, do, study, act, re-examine a new change and see if that change will add upon the one that you've already done, or if you can expand that change into a bigger area of your facility or your organization. If your team believes a different approach would be more successful, or as I put on here, not successful, return to stage 1, plan, develop a new and different plan that might result in success. So if it is successful, you want to spread that and you want to keep moving and building upon that. Otherwise, you can just start from stage 1 again and do that incremental change. The PDSA cycle is ongoing, and organizations become more efficient as they intuitively adopt PDSA into their planning. So the actions are, you show that incremental change and it becomes a catalyst for new change. Some action steps are preserve your gains and keep sustaining these accomplishments. Also, based on measurement review, make changes in your procedures as needed to help facilitate that change. And also communicate your accomplishments to internal staff and even externally to customers and share those lessons learned. Again, the systematic approach for quality improvement is the systematic analysis and its systematic action. So the QAPI approach is to develop systematic approaches for making decisions or analysis and taking actions to improve and sustain quality through the performance improvement activity. The systematic approach is used to determine when in-depth analysis is needed, and the organization uses a structured approach to determine whether and how identified problems may be caused or intensified by the way by their care and the services that are organized or delivered. So it is expected to demonstrate that root cause analysis again. As far as systemic action, look comprehensively across all involved systems to prevent future events and promote the sustained improvement. So eliminate the causes and stop having Band-Aid fixes. Again, you want this to be focused on continually learning and continuous improvement. Facilities are expected to develop policies, procedures again, and have this as their systemic approach. Here's a list of approaches that an organization could adapt to prevent future bad events and also sustain improvement. You could update the policies again, as we said, clearly define roles and responsibilities for actions, communicate the changes and its purpose to all those needing to carry out those actions, identify and correct barriers, roadblocks that may be in the way of doing things that new way, integrate the new changes into new employee orientation or into their training programs, and ensure that there is adequate funding to support that change. And that's part of why you look at all of the SWOT, you look at the all of these planning and tools that you use in that process are very important so that this part of it and applying the systemic approach, it will make it much easier. So that's QAPI. Thank you to those that have been joining our sessions. Through these sessions, we have introduced this quality assurance performance improvement model, and this is supported by CMS. Again, these tools are used and taken from the Institute for Healthcare Improvement and the Model for Improvement. This is a framework that we have used in these sessions. These can be found, some links to these can be found at the end on a slide at the end of these slides, and please make sure to reference those. We will be having more sessions, and I just wanted to give you an idea of what's coming up. Session 4, the basics of data, will be November 18th, and it will be delivered by one of our data analysts at Mountain Pacific Quality Health, Dorota Carpenedo. She will look at data collection and management and also at some data analysis. So this session will touch upon the use and handling of data, such as data use agreements, storage, and sharing, and kind of look at some of those requirements that we all have to adhere to. Session 5 will be about interpretation and impact. It is on December 2nd, 2020. And I know Dorota is planning some project or homework, so make sure you're ready for that and roll up your sleeves. Again, I want to thank you for joining us. And again, the next session will be November 18th. And please, if there's any questions, did we miss anything in the chat that we needed to follow up on? Stevie, did you see any? I don't see anything in the chat. But again, you will be getting emails coming out, and it will have the slides, where you can find the slides, and also where you will be able to find the recording. Thank you very much.